Welcome to On The Beat, everyone. I'm over here with Robert Phyfer from Brooks Eye Centre, and today we're talking about diabetes and the actual eye. How are you, my friend?
I'm good. How are you?
Now, I do understand that diabetes does affect our eyesight, right?
It does, yeah. So diabetes can actually cause vision loss over time.
I know, like, who would have thought that something that's going on within our body can affect our vision as well?
Yeah, I mean, it's a possibility. The biggest thing is to keep the blood sugar down and make sure you're taking your medication properly.
All right, well, let's just break it down a little bit. What is diabetes to begin with?
Diabetes is when the blood sugar in the body gets too high and it becomes toxic to the blood vessels. Eventually that causes strain on the pancreas, and the pancreas continues to stop working.
Okay, so well, how does someone, prevent diabetes retinopathy?
Diet and exercise and medication if they're taking it. Now there's two types of diabetes. There's type 1 and type 2. Type 1 is genetic.
Right.
Type 2 is more, we haven't been eating like we're supposed to, not exercising properly, and that can cause strain on the pancreas over time.
So what's happening with the eye? You're losing vision, or is it blurry? Or explain to someone the symptoms that they would be expecting.
Diabetes can cause cataracts. It can actually cause dry eyes. It can cause bleeding in the back of the eye. The biggest issue we see is that it actually causes retinopathy, which can cause vision loss. The bleeding leads to swelling, swelling leads to scarring, and scarring leads to your vision loss. Sometimes it can cause retinal detachments. We see those, but not very often. And the biggest thing is to just make sure you get, see an eye doctor to make sure that nothing is going on if you are a diabetic. Sometimes you wouldn't even know that you've got anything going on in the back of the eye to begin with.
Right. And the thing is also, we want everyone to know that you might start seeing these symptoms and not even know you're diabetic.
Oh, absolutely. We send people out for blood work all the time because we may see a little spot of blood here, or their prescription changed a little bit so their lens has swollen, or they've got early cataracts. And so we'll go in and run a blood panel to check to see if they've got diabetes. Then we'll get them in with a primary care doctor to see if they need extra help with that.
Yeah. Okay, well, for someone who does have diabetes at home and should be having their eyes checked, is it annually? Is it quarterly? How often should one be doing that?
It really depends. Good question. So at least every year, but my diabetics who are uncontrolled, they need to be seen more often than someone who's not someone who's controlled needs to be seen every year. Someone who's not controlled needs to be seen a little bit more. Depends on what's going on. If they've got bleeding in the back, I may see them every 6 months, sometimes every 3 months. If
really?
Yeah, it can be as frequent as every 3 months.
All right, well, what are some of the treatments that someone can have from diabetic retinopathy?
Well, typically what we'll do is we'll send them to a retinal specialist if there's swelling or bleeding in the back of the eye, and they'll do an injection. If they've got leaky blood vessels growing in the back of the eye, they'll do a laser procedure. If they've got a retinal detachment, they'll do a laser. They may actually have to go ahead and do a retinal detachment repair as well. So there's a lot of different treatments for diabetic retinopathy, but what it boils down to is we can actually help save people's sight with these treatments, whereas years before we didn't have the option to do that for certain people. And so technology has come a long, long way to keep people's vision.
Isn't that amazing?
It's awesome, yeah.
Very quickly, why did you get into this type of business?
So I'm from West Point, grew up there, shadowed my optometrist in high school, and I was the typical glasses contact lens patient.
Okay.
And I stepped foot, and his name's Dr. Cheatham, stepped foot in his office, and next thing I know, I'm seeing glaucoma, the next patient's going blind from diabetes, and then all these different things are going on. And I was like, whoa. This is totally different from what I've experienced as a patient, and this is really interesting. So it was more medical, and that was something that I was looking for, a medical field to go into, so that's why I chose optometry.
Yeah. Well, we appreciate you coming
Thank
in again,
you.
always giving us great information. If you want to find out more, there it all is up on the screen for you. Come over and see Dr. Robert Phyfer at Brooks Eye Centre. As you can see, he is a man full of knowledge. Back after this short break.